Good afternoon, everyone. Thank you for joining us. I would like to remind everybody on the telephone to please, or on the Zoom call, sorry, to please press star one to enter the queue. You're limited to one question and one follow-up. I would also ask that you please take your phones off mute. You're not audible until I call your name. First question. Oh, sorry, Minister. Getting ahead of myself here. I will now turn it over to Minister Dix. Go ahead, Minister.
Hey, I thought we were moving to the questions a little quickly there. That's great. Hey, it's great to be on. And the only thing that would be better is if we were together in Penticton doing this together today. I'm honored, of course. I want to acknowledge where I am, which is in Victoria, on the traditional territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. It is great to be here on their lands. I know others where you are in Penticton and elsewhere are going to be doing your own land acknowledgements in your presentations. I just want to introduce for everyone all the people who are going to speak today, because this is a really exciting day for all of us. First, Susan Brown, the President and CEO of Interior Health. And Interior Health, I think, and you can see this in both the results on COVID-19, but the effort that's been put forward by Interior Health throughout this pandemic. I know Susan knows this, but I know the team that's working with her at every level, from healthcare workers to health administrators to doctors and nurses and health sciences professionals, everyone who's dealing with mental health and addiction in Interior Health has been 100% all in from the beginning of the pandemic and before. I want to introduce Matthew Baran, who's the Executive Director of the Uke McCain Friendship Center, and it's good to have you here. He tells me there's some people being immunized near him right now, which is music to my ears. And I want to acknowledge the extraordinary work of the Friendship Centers, and really Friendship Centers everywhere, in supporting us in these times, and of course, their role in our community and in Indigenous communities is central, and it's something that we have consistently supported and is a big part of what we're doing today. Dr. Greg Sellinger, I'll give Greg a hard time because I keep thinking I'm going to introduce the Premier of Manitoba or something, but that's not who I'm introducing. He's the board chair of the South Okanagan-Similkameen Division of Family Practice. The division have been close partners of ours. I want to acknowledge Greg and the whole team there, because we have a primary care network that we're working on and building out together in the region that is second to none in the province, and I think is groundbreaking. And that reflects the leadership of Dr. Sellinger and the whole team at the division, and all of the family practice doctors who have really adopted the model of team-based care and improving care for people in their region, in the South Okanagan-Similkameen, and they are making an enormous difference. I think it's no surprise that we've opened clinics and we have a primary care network. And today, of course, not give too much away, an urgent and primary care center in the region that reflects not just the commitments of the provincial government and people in the region, but also the Division of Family Practice. I want to say hi to Dr. Kyle Stevens, who everybody knows in Penticton, so I won't say too much about him, except all of his work at the Martin Street Outreach Center makes an enormous difference. And we're going to have, I know we're going to hear about that and hear about that role in a little bit. And I want to introduce Sean Kelly, who I was talking to just a few minutes ago, who is not only a patient, and so he's here to speak about Martin Street, about the supports he's received in his life, but he's also helping us in many other ways now. He's not just a patient, he's a team member providing services to people. And it's so good to have you, Sean. I want to acknowledge Dan Ashton, my friend Dan Ashton, who I think might be on the line. Dan is, of course, the MLA for the region, and he's a good friend and a great representative. And we've worked together on so many projects over the years in the region, from the hospital to primary care services, to other services in the region, to senior services, and it's always great to have to know that Dan is around. And whenever I go to Penticton, we get together, and it's and I haven't been there in a while because, as all of you know, we're in a pandemic. Urgent and primary care center. So that is what we are announcing today, and I want to say that I am proud to announce that the Urgent and Primary Care Center, that's UPCC, in Penticton will be opening March 31st. And then it'll be a phased opening, and over the coming months, it'll move on to its full status. It'll be operated by Interior Health and will be located at Unit 101, 437 Martin Street. That sounds good. That sounds good. And it will be opening, as I say, as March 31st. It's being opened by Interior Health. And let me say this, and Susan's on the line, she knows this, that Interior Health has done an extraordinary job with urgent and primary care centers. It's one thing to drive forward with an idea and provide support and fund it, but the urgent and primary care centers in Interior Health are second to none in the country. Our new urgent primary care center this fiscal year, the one from April 1st, 2020 to 2021, is the second most popular in terms of patient visits in the province, the one at the Capri Mall in Kelowna. Our Kamloops Urgent and Primary Care Center and Learning Center, one of our most popular and our first and truly innovative. Vernon, where we've moved to our permanent location during the pandemic, has received some 20,000 visits already just this year, and is a real success. And then in Castlegar, a slightly different model, a smaller community where the urgent and primary care center is making a big difference. So people at Penticton know that Interior Health knows how to do this model, and they know how to do this model because we have divisions of family practice who support us. This particular urgent and primary care center opened March 31st, was developed in close cooperation with the South Okanagan Division of Family Practice. There's another call out to Dr. Selinger, the Martin Street Outreach Center, One Sky Community Resources, and local Aboriginal partners, including the Penticton Indian Band, and of course, the Uknakane Friendship Center. We'll be hearing from Matthew shortly. The UPC will be 560 square meters. Now that doesn't sound that big, but it's 6,028 square feet for those of us who remember back to the days of feet and inches. And it will include a reception, a waiting area, exam rooms, consultation rooms, multidisciplinary assessment rooms, among other things. The UPCC will provide attachment and longitudinal primary care with a focus on services for those with mental health and substance use health needs, as well as urgent primary care access. Services will be provided in a phased approach. When the center opens in March, approximately 14 full-time equivalent healthcare providers are expected to work at the center, including nurse practitioners, physicians, and allied health professionals. The team will provide long-term primary care services for people with mental health and substance use needs. These services include complex care management, mental health and substance use healthcare, opioid agonist treatment, and women's health. Many healthcare professionals will gradually join the center, and once it's fully operational, the UPCC will provide urgent and primary care services to people living in Penticton and surrounding communities who need to see a healthcare provider within 12 to 24 hours, but do not require a trip to the emergency room. Some of the reasons for visiting a UPCC for urgent care are sprains, minor cuts or burns, high fevers, and minor infections. The center will work also to connect patients without a primary care provider to a family doctor or nurse practitioner, either at the center or in the community. And attachment, of course, is part of our partnership with the South Okanagan-Similkameen Division of Family Practice. And once it's open on March 31st, it'll be open 8 to 4 Monday to Friday. But when the center is fully implemented, and we think that will happen over the next month or so, care will be available. Urgent care will be available 7 days a week, 365 days a year in Penticton. That is fantastic. The Penticton Urgent and Primary Care Center is our 23rd in the province. And as I say, because it's in the interior and because Interior Health modeled urgent and primary care centers for the whole province, they did the first one. They did many of the most successful ones. I know it's going to be a great success. It is our 6th in Interior Health. And I've talked about them already, but that's Kelowna, that's Vernon, that's West Kelowna, where we started recently. That's Kamloops, that's Castlegar. And of course, in April 2019, we announced a primary care network in the South Okanagan-Similkameen region, which is, I think, increasingly successful. And this UPCC will be, in fact, part of that network. This is great news for Penticton. More health services. It wasn't long ago that Dan and I and many of you were opening the new the new hospital. It feels like a new hospital, a new wing of the hospital, a new center at the hospital, which is, of course, making a difference for lots of other people. The announcement of the Ponderosa Clinic, which has made a huge difference for people in Penticton. The South Okanagan, our South Okanagan Primary Care Network. All of this is building to provide better care in the community. I was talking before we started with Sean. We talked about chronic disease and dealing with chronic disease. I live with chronic disease every day. I have type 1 diabetes. And so that means that whenever I go to a doctor, I have two problems, type 1 diabetes and whatever I'm going to see them about. It means that I, of course, inject insulin 4 times a day and have to be self-sufficient and supported in that. And the difference for me or anyone else with chronic diseases, no matter what they are, whether they're mental health and substance abuse issues such as diabetes or others, require excellent primary care. The idea is not for us to use our hospitals for that purpose, but to give people great care in the community so they can both take more control over their lives and get more support and don't have to go to the hospital. That's what urgent and primary care centers are all about. It's absolutely a great thing what Interior Health has done in Kelowna and West Kelowna and Vernon and Kamloops and Castlegar, all over the region, and coming up, and West Kelowna, and coming up, Penticton. And with that, I'm happy to introduce the CEO and President of Interior Health, Susan Brown.
Thank you very much, Minister Dix. It's a real pleasure to be here, and I'd like to acknowledge the traditional territory that I'm coming to you from today, which is the Stillits Nation, where we're privileged to live, learn, work, and collaborate. So it's wonderful to be part of this official announcement today, where, as Minister said, it's our 6th urgent and primary care centre, which will open later this month. And we know the difference that this makes to families and patients, and that will serve Penticton, Summerland, and the surrounding areas. The UPCC is part of the larger primary care network, and we've been working in the South Okanagan for a couple of years to develop that, and it's been great. We're proud of to work alongside our partners, the Okanagan Similkameen Division of Family Practice, the Penticton Indian Band, the Osoyoos Indian Band, the Lower Similkameen Indian Band, and the Upper Similkameen Indian Band. Working together, we're not only strengthening, but we're growing the primary care services and adding new options for patients and families across the region. Many people live with mental health every day and substance use challenges, and we know how important it is to have services that are welcoming and accessible. In planning this UPCC, we've worked closely with our physicians and the care team at the Martin Street Outreach Clinic, building on the incredible care they've been delivering since 2015. Our planning also included engagement with other local medical practices and walk-in clinics to understand what was working well and where there was an opportunity to improve the healthcare services. With their guidance and input, the Urgent and Primary Care Centre will complement the care of those practices and walk-in clinics that they currently provide. We also worked with the Okanagan Friendship Centre and One Sky Community Resources to better understand the local needs. Their insights and guidance have and continue to be invaluable. Most importantly, we heard from patients directly. They have told us that they want services that are inclusive, stigma-free, and easy to navigate. This UPCC will help people who are struggling, who need care, to be connected to the greater healthcare system. Once open and fully staffed, the Penticton Urgent and Primary Care Centre will be a place where patients will come for urgent same-day care. It will be a new convenient option for community-based services. It will also provide urgent primary care options in the evenings, weekends, and holidays, augmenting the excellent primary care practices that are already existing. We know that that makes a great difference for families and patients. The centre will connect them to a regular primary care provider as well in that community through the South Okanagan Similkameen Division of Family Practices patient attachment list. Just as we've engaged partners, we've tapped into the knowledge of frontline staff staff whose expertise is informed by their experience every day. Here in Penticton, the UPCC will include physicians, nurse practitioners, physiotherapists, and social workers, reflective of a team-based and patient care-centered approach. Teamwork will indeed be the hallmark of this centre. I'd like to thank our local physicians, the division, the Penticton Indian Band, Ukaneen Friendship Centre, and One Sky Community Resources for your commitment and collaboration on this project. And I'd also like to thank our interior health teams who've supported this work over several months to get us to this point. It's exciting to know that very shortly the doors will open and people will be receiving urgent and primary care right locally in their community. It's even more exciting to realize the impact the centre will have on patients and families in these communities. And we've seen that from the other 6 communities that have had the opportunity to have a centre like this. So thank you, Minister, and thank you everyone who has been a part of this journey. And I'd now like to pass it over, to one of our partners, Dr. Greg Selinger, who will speak on behalf of the South Okanagan Similkameen Division of Family Practice. Thank you.
Thanks, Susan. It's I'm grateful to be here on a sunny day on the unceded territory of the Syilx people of the Okanagan Nation. It's a great place to live and a great place to work. On behalf of the South Okanagan Similkameen Division of Family Practice, I'd like to thank the Honorable Adrian Dix as well as Susan in Interior Health, and to welcome the new urgent primary care clinic to the network of primary care in the South Okanagan. It's great to have more. It's great to have more resources in the community. It's always great to have more help to be able to provide the care to our patients and to be able to have patients have better access to care. Through collaboration with our partners, the Urgent Primary Care Clinic will be able to augment the access to primary care provided in the network already and really complement what we're doing and complement what we're trying to do and be able to help us build a better network so that patients and their families are able to access the care that they need when they want it and from who they need it from. This will be through the provision of mental health substance use services by the primary care providers using a team-based care approach by having family physicians and nurse practitioners working alongside other allied care professionals that really help augment the care that these providers can provide to the patients that come to see them. It will also work alongside our current walk-in clinics to provide urgent primary care services to the patients of our communities. The walk-in clinics we have are working hard. They do their best to try to keep up, but it's great to have more help on the ground to be able to support what they're doing and work alongside them. UPCC will also be able to help facilitate attachment of patients to a primary care provider, either a family physician or nurse practitioner, so that the patient will benefit from having a primary care provider that knows them well and will be able to follow them longitudinally. It's to really wrap around the care around the patients and to be able to get the patients the care they need. I'd like to really take this opportunity to acknowledge all the hard work from the staff of the division working alongside other partners, which would include our executive director, Tracy Sinclair, Dr. Tim Phillips, who's been working with PCN from the start and really has a good grasp of team-based care, and Tanya DeKers, who's a nurse practitioner, to bring that lens with the division as far as working with UPCC. So I want to thank the Minister and Interior Health for making this possible. And I'd like to now take an opportunity to just introduce Matthew Barron, who is the Executive Director of Ukaneen Friendship Centre in Penticton.
Thank you. Why Haskell Halt? Why Peace Naxil? Why Kalhap Kalhap? My name is Matthew Barron. I'm the Executive Director of the Ukaneen Friendship Centre, and I did my best to introduce myself in the traditional language of the Syilx people, the Syilchin. I do so out of respect for the territory we're in, and want to acknowledge the language as best I can. Urgent and primary care centers are imperative for Indigenous people in this province. It's been well documented that 75% of Indigenous people do not have regular access to a family doctor. And this new model will allow ready access to preventative and primary medical care. And that's a huge step for Indigenous people. One of the cool things that we like to acknowledge as well is that our ability to be involved from early implementation concepts, making sure that every piece and every stitch is culturally appropriate and sensitive. And I want to thank Interior Health for having that insight. It was very positive to be part of that. I'd like to also take the time right now to quickly thank all the healthcare providers that are keeping us safe. I don't think they get the acknowledgement that they deserve right now, and I just wanted to say limit to them. So thank you very much. I'd now like to introduce Dr. Kyle Stevens.
Thank you very much, and thank you for the opportunity to talk. I'm a family doctor who's been providing addiction services in our community for over 15 years. And 6 years ago, we opened up Martin Street, the outreach center. And that was opened up specifically to access or provide access to our most vulnerable patients, typically those with significant and severe persistent mental health or substance use issues. At that time, we had a goal of about 250 people that we thought we might need to serve. We had 4 doctors who were interested and involved in that clinic. Today's numbers, we have over 1,200 people registered at Martin Street Outreach Center. We have 9 physicians working and a nurse practitioner. We also have a full-time social worker there. So our team has expanded tremendously over the last year, and we are literally out of space, not just metaphorically, but literally. So this can't come at a better time for us. Not only are we getting extra space, we're getting extra team members to help wrap around care. We know that's so important for this patient population. So we're going to have a social worker and a nurse to provide the care that's needed at the time. It's a low barrier clinic, so we meet people where they're at. They come in and we find out where they are and try and see them at that point. And it's been a pleasure to work with the team. And I'm thrilled that Sean Kelly has agreed to speak, and he's currently receiving services at Martin Street Center. Thank you.
Thank you, Doctor. Yes, I am a patient here, and I believe that it's absolutely crucial for people to have access to a doctor and to be steered in the direction that they need to be going. Because if it wasn't for me coming here throughout a lot of situations in my life, mental health, addiction, they go hand in hand, and trauma. They have been immeasurably helping me just to deal with everything day to day. And I know that they're there. And that's the most important part, because it's addiction and mental health is fear-based. You know, we can see now what's happening, that it covers all everybody from the lower spectrum to the higher spectrum of life. It affects everyone, and it's just hugely important to invest in our people. So I am just very, very happy that this is going to extend on and become a bigger thing and allow some more people to get some help. So thank you very much for having me, and thanks to the Friendship Center for all that they do, because I see them around this town a lot. Thanks to the Indian Band. You guys are doing a great job. Thank you very much. And that's it.
Thank you, Sean. We will now go to the question portion of the event. As a reminder, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up only. First question today is from Shelby Tom, Global Okanagan.
Hi there, can you hear me okay?
Can hear you great, Shelby, thanks.
Great, thank you for taking my question. Some housing operators in Penticton have come forward today saying that there's a gap in support for people with severe mental health and addictions issues who are essentially being kicked out of supportive housing facilities for problematic behavior. They're calling for a new model of complex care housing. So my question to the minister, as well as Susan Brown, is the health authority in the province currently failing the hard to house who are experiencing health issues? And will the complex care housing model be supported by IH and the minister? Thank you.
Well, thank you for the question, Shelby. I think these issues of people who are hard to house, who need supports, require a number of responses, not just one. And what we're talking about today is one of those responses, providing better team-based care in the healthcare system. That's one of the things the primary care network does, not just give a person access to a particular health professional, but a team of health professionals working together, which allows us to support people, not those who would live in, for example, BC housing or another project, but people who are housed marginally in the communities and need supports in order to continue to live and get better and in some cases, of course, survive. So of course, we're looking to improve the quality of care and supports we have in supportive housing. I would say this, Shelley, there's been a very significant increase in the number of housing spaces available for the hard to house in BC over the last number of years. Having housing is an important aspect to that. And providing supports such as those provided by urgent and primary care centers and primary care network that's provided at Martin Street is an important complement to that. So we do need to provide appropriate supports for people in addition to housing, because for many people, having a house is not enough, or having housing is not enough, or having their own place is not enough. It's important, but not sufficient. So of course, we're looking at applying and supporting our housing in British Columbia, both by expanding the amount of housing available and by improving the quality of supports for people living in that housing. That's a necessary response and something we've done consistently since 2017, since the government took office, and are going to now have to increase given the challenges facing the province.
Shelby, do you have a follow-up?
Yeah, I had asked for Interior Health to respond to that question as well, please.
Thank you very much. So I think one of the things that people with mental health and substance use have identified is getting that early opportunity for care. And that's exactly what we're talking about today. This urgent and primary care centre will be able to assist people. We know that I've heard from the physicians who work there that they'll offer opioid antagonist treatment, which is a way that people can have safe drugs and also opportunity to move away from taking drugs altogether should people want that choice. So the centre's there for people. It is a multidisciplinary team. We're hoping that does allow that easy access for people and get to people early so that, and have them attached to a team so that when they do start to get into trouble, there's a way that they can reach out. Thank you.
Thank you. Next question is from Brennan Phillips, Penticton Western News.
Hello, Mr. Dix. My question, one second, is regarding the Ponderosa Primary Care Clinic, which you'd mentioned earlier, which has proven to be quite successful at attaching patients and attracting doctors to the community. And my question is, why not provide more funding for primary care clinics like Ponderosa in the community?
Well, I feel that that's a good question for me, and perhaps Dr. Selinger may want to speak to it as well. That's what primary care networks are all about: providing supports for existing doctors, building out team-based care in the community for doctors and nurses and nurse practitioners and other healthcare professionals. That's what the purpose of the primary care network, of which Ponderosa is a key part in this community. It's the purpose of them. So we are dramatically increasing funding and support for primary care in a way that health authorities haven't done before, through primary care networks, which we're supporting, through clinics such as Ponderosa, which is very successful, and through urgent and primary care centers, which will add yet another model. And the important model, remember here, is to provide care on Sunday and on weekends and holidays, something that frequently isn't provided to the necessary extent. And that's why once we're fully operational, these will be open in Penticton from noon to 6 every Saturday and every Sunday, providing care in the evenings from 5 o'clock to 8 o'clock in hours where people are working. Frequently, the hours that offices are open are not the hours where people can best access care. So these additions, urgent care, supports for mental health and addiction services, primary care networks to expand access to healthcare professionals and have them work together as teams. Centers such as the Ponderosa Center that attach with the purpose of, and our purpose together here is to provide what's called longitudinal care, is to attach people to healthcare professionals, nurses, nurse practitioners, nurses, doctors, so that the person who sees you has history with you, understands your long-term needs, and you can build and support your health that way. I think I told you earlier I have type 1 diabetes, so when I go and try and get care and try and access the healthcare system, as I do from time to time, if I see a different doctor every time, or my care is disconnected, then you have to spend almost the entire appointment reviewing your past history. And if you have experience in that system, if they're connected with you, if you have good networks of technology and you have primary care networks, I can get the appropriate care, which might be for someone with diabetes, a dietitian. It might be for someone with diabetes, a nurse practitioner. It might be for someone with diabetes, another health sciences professional, or it might be a doctor or a specialist, a GP or a specialist. So that's what we're doing. And Penticton is a model for British Columbia. There are a significant number of people without family practice, doctors or nurse practitioners, and that is why we established the primary care network, why we're proud of its success so far, why we're proud of Ponderosa. And this working with all of those people, this Urgent and Primary Care Center, is one more step towards providing the primary care that people in the South Okanagan Similkameen deserve.
Yes, I would agree. I think this is just one part of the bigger network, and the network is for primary care, and primary care has a few different areas. It is you can have some specialized focused primary care, much like what Martin Street providers are doing. You can have longitudinal primary care, for which what you see in Ponderosa and what you see in a traditional family medicine clinic or a nurse practitioner clinic. And then there's some urgent primary care, which is the after hours care that it has been a bit more difficult to be able to really address, mainly because the family physician providers that are working in longitudinal care are also doing the best to keep up with urgent care. And there are only so many hours a day. And so having another clinic like the Urgent Primary Care Clinic to be able to help support the primary care providers that are working in the community to provide the urgent care services to their clinics for their patients at their clinics when they just can't be open is definitely an asset to the community. And I think that having a clinic like this helps round out the primary care in the community, because no one clinic and no one type of clinic is going to be the answer to everything. I think it's going to take a network of different types of services that all support each other to provide that wraparound primary care that our patients need.
Next question is from Binder Sajjan, CTV. Binder, are you there?
Hi, can you hear me?
Go ahead. Go ahead.
Oh, sorry. Minister, congratulations on the announcement. I just wanted to ask you about another community. Cumberland is dealing with a potential loss in ambulance services. So the ambulance service is getting ready to introduce a new response model. What do you say to the people of Cumberland and communities like it who are worried that the switch to scheduled on-call services are going to result in far less coverage and longer response times?
Hey, thanks very much for your question, and I'm happy to get an update on the situation in Cumberland. I would say, in general, we've significantly increased the number of FTEs in our ambulance service. 120 full-time paramedics in the last 2.5 years, which is a significant improvement. We've added community paramedicine services everywhere. And I'm happy to follow up, even before 5 o'clock on the situation in Cumberland. I'll check with BC EHS where they see it going there. But our approach has been, throughout the pandemic in particular, to increase access to rural and remote services, which would include communities such as Cumberland, which is close to the Comox-Courtenay area, but of course has its own community needs. That's been our approach from the beginning of the pandemic, and I expect that to continue. In fact, over the last couple of years, even given the challenges in many growing communities. And I would include communities in the Central North Island in this, which means it's sometimes more difficult to get to a call. We've seen significant improvements in response times in that period, and that is our expectation everywhere. And that increase in resources has led to that. And I just finally, I think we want to just shout out to all our ambulance paramedics who are dealing, as you know, with the reality of 2 public health emergencies, as all of our healthcare providers are and are doing an extraordinary job. So we'll follow up with you in the next, assuming you've got a 5 o'clock deadline, we'll follow up with you shortly on the details.
You have a follow-up, Minder?
I do. Yes, that would be great. Thank you so much, Minister. To ask you, yesterday, Dr. Henry talked a little bit about essential visits and visitors to long-term care homes. Do you have any more details about what people can expect and when?
Well, the first thing, because we were talking about Comox and Courtenay and Cumberland, the outbreak at Glacier View Lodge is over, which is really good news. There was only one staff person involved in that outbreak, but it's whenever we can announce the end of an outbreak. I know that Susan Brown knows this in the interior. Every day we announce an outbreak is not a good day, and every day we see one over is a very good day. And I think we're down to 5 in long-term care across BC. So what have we done in long-term care? Well, we've immunized everybody, and I think to a great degree, at least had clinics in every care home, and we've reached, I think, 98% of our target in healthcare workers in long-term care, about 92% of total residents. Some can't get the vaccine and or have been COVID positive in that period, but 92% of residents. We've immunized 6,000 essential workers, a similar level of immunization in assisted living. So what that has allowed is what we've seen, which is a reduction, that and other infection control measures in the number of outbreaks we've seen in BC in long-term care, and will allow us I think, before the end of March to announce the changes to give more access to families, to their loved ones in long-term care, and more access to residents in long-term care to some degree of a more normal life. Some of that is happening right now in our long-term care homes. There's certainly more activities within long-term care homes that are going on now than there were at the height of the period of pandemic, or would have in December. But this is a top priority for me. You'll know personally, my family is involved as a family of someone we love in long-term care. And I want to say finally how important it is, I think, for all seniors, because this question of isolation and what the vaccine will allow, not just for seniors living in long-term care, but many seniors living at home who have been and who are or have been isolated during this pandemic due to their concerns about their health, their legitimate concerns following public health orders. One of the purposes of the vaccine effort is to give people more access. So the short answer is there will be changes. You'll see them in the month of March, and they're based on the fact that long-term care homes are now safer because we've had immunization at all of them, and a very high take-up in long-term care, much more so than anywhere else, I should say, in long-term care. Much less vaccine hesitancy amongst workers and residents in long-term care than just about anywhere else. This allows us now to contemplate and put in place some changes to make life better for essential visits and for others.
Mary Brooke, Island Social Trends.
Hi, thank you. Minister Dix, now that the immunization clinics are opening, and people may wonder if they have a choice whether to go to a clinic or to a pharmacy or to a doctor's office to get their shot. And I'm not sure what their preference might be, but part of it might be the type of vaccine they might receive. So do you have any comments on that process?
Right now, we have, I don't believe the AstraZeneca has arrived in BC. We have 4 vaccines approved in Canada. We have 2 that have come to BC that we've been using in significant quantities. Both of them have been very successful, Pfizer and Moderna, in reducing people's vulnerability to COVID-19. In fact, we've seen that as evidence with our most vulnerable people in care homes. So there will not be a great deal of, you won't be able to choose your vaccine, but all of these vaccines have been demonstrated in clinical trials to be very effective, and the real world evidence for Moderna, for Pfizer, and for AstraZeneca, the real world evidence, these are vaccines that have been used by millions and millions and millions of people, is extraordinarily successful. Now, there will be some potential choice in this respect, that people who may be immunized as essential workers may well choose to wait for their age group. It is almost unheard of and will not happen that a politician such as me would be declared an essential worker in this terms. And so I'll be waiting until my age group, 55 to 59, gets the vaccine. But if I did have that choice, potentially I could wait for my age group if I wanted Pfizer or Moderna, which are the core vaccines for our age campaign, and not for one that might be for AstraZeneca or for Janssen, which might go to support essential workers or deal with outbreaks. But generally speaking, we're not going to be choosing our vaccines. Right now, the vaccinations are taking place in clinics. There were more than 1,200 of them in phase 1 in long-term care homes across BC and many other locations. We announced about 180 locations on Sunday for phase 2, and there'll be more locations for phase 3. We're going to be adjusting our efforts as we go along, and especially and perhaps potentially in the midterm for dealing with second doses, for example, once everyone's received their first dose. But our approach right now is to have clinics in every part of the province, 180 clinics, dozens in Interior Health, and dozens on Vancouver Island, that will serve people and allow them to be immunized in an efficient way. Part of the reason, of course, we're doing this is that we're also immunizing people in order effectively of age and vulnerability. And that's why we laid out our plan pretty carefully on January 17th. And again, a week ago, Monday.
Follow up, Mary?
Yes, please. So with this BC-wide ad campaign that was mentioned weeks and weeks ago in one of your press conferences, so that media everywhere in the province, I presume, could carry the message to their readers and listeners about where the locations are of these clinics. And some smaller papers have been overlooked in this regard. And I'm just wondering, in terms of supporting small business in BC and the journalism process that's been covering COVID quite religiously for the year, how that can be addressed.
I'll certainly pass on your suggestion to the people in government who are placing the ads. I can tell you that there is enormous interest. We saw this on Monday, and this was a discussion for an earlier press availability, so I'll leave it there. But there's enormous interest, obviously, in the immunization effort, that the sites of all of our clinics are posted on health authority websites and through the BC CDC and the government website, and are being provided all over. Essentially, in every case, you'll be booking an appointment. At present, that appointment will be booked through call centers. And as you know, we've had some challenges in the last day in our call centers, but they'll be booked through call centers. And in the near future, through a provincial online application as well. So we will book an appointment. They'll be able to choose their location and then go and get immunized. And that's the process that we're going through to immunize the 4.3 million people who are eligible for immunization right now. So it's a big process. It's going to take a series of months, but we're hopeful in the relatively near future, certainly by the end of July, if not before, that everyone who wants the vaccine in BC will have their first dose, and then obviously we'll be proceeding to do second doses.
We have time for one more quick question from Richard Zussman, Global News.
Richard.
I'll be really quick and hi, Minister. I'll be really quick, and this is for a colleague. What she's reporting is that there's a 9-month wait for treatment support for kids with anorexia, and that there are just 7 beds for treatment and support in the same regard across the province. Is this enough, and are you worried that there's a lack of support for those youth with anorexia in British Columbia?
Yeah, the issue of people dealing with eating disorders of all kinds, including anorexia, are significant in our province. Their challenges are significant. And you'll understand, Richard, and I know your colleague will, that it requires a continuum of care. So some of it is the need for in-treatment beds, and that's a subject that's been discussed for many years in BC. And in addition to that, though, other forms of treatment, including treatment provided in primary care by doctors such as Dr. Selinger, because many people who deal with eating disorders have other conditions as well that they deal with. So we have added some significant resources for those with eating disorders during the pandemic in terms of supports for primary care. But we can absolutely always do more as well. We know that access to care in this area is a struggle, but it's not just one part of it. It's not just in being treated on a permanently or every day and in treatment services or in those services. It's also providing services in the community to give people support. These are very challenging chronic diseases that require long-term supports, and we have to build up every element of our system to support them, not just one. But the short answer is there's always a need to do more, because there's clearly, and I think this has been the case through the pandemic, a need for more services. It's why health authorities have responded with more services in specific ways, and we can always do a better job. And we're going to continue to work on providing better services for people who are struggling, not just with eating disorders, but frequently other conditions that can be associated with that are harmful to them as well.
That's all the time we have for today. Thank you everyone for joining us. I will ask the participants to please stay on, and we will do a quick photo. Everybody smile. Great. Now